USMLE style question. A 72-year-old man with a history of hypertension, diabetes mellitus, and hyperlipidemia is brought to the clinic by his daughter due to progressive cognitive decline over the past 2 years. She reports that his memory has worsened, but she is more concerned about his difficulty making decisions and slowed thinking. His symptoms seem to have worsened in a stepwise fashion, with each decline followed by a period of stability. On examination, he has mild right-sided weakness, brisk deep tendon reflexes, and gait instability. MRI of the brain shows multiple infarcts in the subcortical and periventricular regions. Which of the following is the most likely underlying cause of this patient's condition? A. Extracellular beta-amyloid deposition in the cortex. B. Tau protein inclusions in the frontal and temporal lobes. C. Progressive degeneration of dopaminergic neurons in the substantia nigra. D. Multiple small ischemic infarcts due to chronic vascular disease. E. Autoimmune-mediated demyelination of white matter tracts. Answer and explanation. D. Multiple small ischemic infarcts due to chronic vascular disease. This patient presents with vascular dementia, which is the second most common cause of dementia after Alzheimer's disease. Key features of vascular dementia. Risk factors: hypertension, diabetes, hyperlipidemia, smoking, stepwise cognitive decline. Each infarct causes worsening symptoms, executive dysfunction, and slowed processing speed. Neurologic deficits, e.g. hemiparesis, hyperreflexia, gait instability. MRI findings: multiple infarcts in cortical, subcortical, or periventricular regions. VaD results from chronic ischemia and multiple infarcts, affecting the brain's cognitive and motor pathways, leading to subcortical white matter disease and lacunar infarcts in deep brain structures. Incorrect answers. A. Extracellular beta-amyloid deposition in the cortex, seen in Alzheimer's disease, which presents with gradual memory loss rather than stepwise decline in neurologic deficits. B. Tau protein inclusions in the frontal and temporal lobes, seen in frontotemporal dementia, FTD, PIC disease, which presents with early behavioral changes rather than vascular risk factors and focal deficits. C. Progressive degeneration of dopaminergic neurons in the substantia nigra, seen in Parkinson's disease, which presents with bradykinesia, rigidity, and resting tremor rather than multiple infarcts. E. Autoimmune-mediated demyelination of white matter tracts, seen in multiple sclerosis, MS, which presents with relapsing remitting neurologic symptoms, not a stepwise cognitive decline. Key learning points: vascular dementia, stepwise cognitive decline with executive dysfunction, history of hypertension, diabetes, hyperlipidemia, and strokes, neurologic deficits, hemiparesis, hyperreflexia, gait impairment. MRI findings: multiple lacunar infarcts and subcortical white matter disease. Contrast with Alzheimer's disease: VaD stepwise decline, focal deficits, AD equals gradual decline, memory loss. Would you like a question on mixed dementia, vascular plus